and long-acting anticholinergics to tropium enhance bronchodilation, improving airflow. 2. Inhaled corticosteroids, fluticasone and budesonide reduce airway inflammation, especially in patients with frequent exacerbations. Medications prescribed. 1. Bronchodilators, short-acting 2 agonists, albuterol and long-acting anticholinergics to tropium enhance bronchodilation, improving airflow. 2. Inhaled corticosteroids, fluticasone and budesonide reduce airway inflammation, especially in patients with frequent exacerbations. 3. Combination therapy, combination inhalers like fluticasone salmeterol provide both anti-inflammatory and bronchodilator effects. 4. Phosphodiesterase 4 inhibitors, roflumilast, may be prescribed in severe cases to reduce inflammation. 5. Oxygen therapy. Supplemental oxygen is essential for patients with severe hypoxemia, improving overall oxygenation. Nursing interventions. 1. Oxygen therapy management. Monitor oxygen saturation levels regularly and ensure proper administration of prescribed oxygen therapy. 2. Respiratory hygiene. Encourage effective coughing techniques and promote airway clearance to reduce the risk of infections. 3. Exercise promotion. Develop and implement individualized exercise plans to improve respiratory muscle strength and overall endurance. Nursing health education. 1. Smoking cessation. Provide comprehensive education on the importance of smoking cessation and available support resources. 2. Medication adherence. Educate patients on proper inhaler technique and the importance of adhering to medication regimens. 3. Symptom recognition. Instruct clients to recognize early signs of exacerbations and the importance of seeking prompt medical attention. Safety. 1. Home safety. Assess the home environment for potential hazards and educate clients on safety measures to prevent falls and accidents. 2. Emergency action plan. Develop and review an emergency action plan outlining steps to take during exacerbations or worsening symptoms. 3. Travel precautions. Educate clients on travel safety, including carrying necessary medications and having a written medical summary. Nutrition. 1. Dietary support. Collaborate with dietitians to develop nutrition plans addressing potential weight loss and malnutrition common in COPD. 2. Hydration monitoring. Emphasize the importance of maintaining proper hydration, as dehydration can exacerbate respiratory symptoms. 3. Nutritional education. Provide nutritional education, focusing on foods that support lung health and overall well-being.